Assalamualaikum warahmatullahi wabarakatuh. We are from the last group. So the first, I want to introduce my group. I am Debbie Priscilla as a first speaker and my partner Khairunisa as a second speaker. So here's the content that we are going to discuss. For the first, introduction. The second, speech delay. The third, fourth, and the voicing distinction in speech disorder. And the last, summary. So, as the first speaker by me, I want to explain about my topic, introduction and speech delay. Introductions. A treatment of speech disorders in Handbook of Psycholinguistics implies the relevance of the latter disciplines to an understanding of the disorders. Although this relevance may seem self-evident to some readers, after all, psycholinguistics concern the process underlying the productions, perceptions, and comprehensions of language, of which speech is an uncontroversial component. For example, an English-speaking post-stroke patient who on perceptual analysis produced an apparent speech error of replacing a voiceless stop consonant such as P, T, or K with its voice cognate such as B, D, or G, and whose voice onset time or VOT. For the error is in the short lag range, say less than 20 milliseconds, rather than the target appropriate, and long lag range greater than 30 milliseconds might be said to produce a phonemic, not a phonetic error. So, in this view that the patient makes the mistake of choosing the wrong phonological unit, not misarticulating the chosen unit correctly. This explanation depends on assumption about the psycholinguistic process that connect phonological units with their phonetic implementations. Next, speech delay. If there is a speech disorder that has been most influenced by psycholinguistic models, it is certainly the group of developmental disorder referred to as speech delay. Simply put, a child with speech delay is one who produces segmental errors that are not age-appropriate but are not unusual in the typical progress of speech development. For example, a child who consistently omits word initial obstruents would not fall into the category of speech delay, at least as conceptualized by most clinicians and scientists working in the area. Thus, an otherwise typically developing child age 6 who produce a profile of speech sound errors consistent with a typically developing child age 3.5 years would be said to have speech delay. So, a child who produces errors considered to be atypical for the normal sequence of speech development. For other example, the well-known case of an older child who has difficulty with a small set of sounds typically mastered late in language that use them constructively would clearly be categorized as having speech delay, specifically one involving so-called residual errors. So, this example referred before to a group of disorders falling under the rubric of speech delay because depending on the classification system, different types of delay qualify for the classifications. Next, from functional misarticulation to optimality theory, a brief tour. Before terminology and perspective from the discipline of psycholinguistics found their way into thinking about speech sound development problems, children with a broad range of articulation problems but no obvious underlying causal basis for the delay were called functional misarticulations. So, functional misarticulation was clearly a wastebasket term, much like the use of the term idiopathic in the literature on certain disease, as in idiopathic Parkinson's disease, but it served the purpose of distinguishing speech speech delay children without obvious physical problems from those with a clear basis for their speech production problems. Next, assumption of speech delay in functional misarticulations. For the first, speech delay has been the relationship between an observed error and the form and or process underlying its production, or ambient phonology. So, in the typically developing infant, such phoneme discrimination abilities have been demonstrated for specific cases as early as 1 month of age and for a broad range of phonetic events before 6 months of age. For example, the child who says "titi" for kitty or "cool" for school is generating her or his word productions from the representations "kitty" and "schools" by Hewlett and Waters 2004. So it means that the child who produced "titi" for kitty or "cool" for school most likely produce other H-top sequence by reducing the cluster to a singlet on consonant. So this assumption is largely one of common sense, but also may have been thought to enjoy indirect empirical support from the lack of apparent perceptual problems, a near normal ability to discriminate between phonemes among children with speech delay. And second, speech delay has been the differences between the receptive and productive phonologies. So, typically done for example of specific production errors that are rejected by the children themselves when an adult produces the aberrant form. For example, children who said "do" for dog nevertheless produce "doji" when asked to give the name for a little dog. So it means that the child who omitted the word final in dog has produced evidence of having the correct underlying forms when asked to inflect the stems. So these assumptions concerning underlying forms and observation made by many investigators was that speech sound errors often occur in groups tied together by an underlying them. Next, specific paradigm shift. There are two important ways a specific paradigm shift in the view of children with speech delay. For the first, psycholinguistic process mediated between the underlying, and the second, phonological process suggests a mechanism for the joint mastery of multiple sounds. For the first, psycholinguistic process mediated between the underlying, phonological forms and their phonetic realization signal a subtle shift away from the belief that speech motor maturity played a central role in the sequence of typical speech sound development and in speech delay. Thus, consonant-vowel consonant, or CFC, syllables reduced to CV by a process of final consonant deletion was consistent with articulatory simplification because CV is the unmarked form. So, it means that the shift from speech motor maturity to phonological process as explanations for speech sound errors is in some ways a subtle move, in light of the strong influence of the markedness concept on the phonological process, not frequently in typically developing phonologies and cases of speech delay. And the second, phonological process suggests a mechanism for the joint mastery of multiple sounds, often cutting across sound classes in the typical development or as a result of treatment in cases of speech delay. In treatment from a speech motor maturity perspective, children would often be given articulatory drill as a form of speech motor practice for specific speech sounds. The repetition was assumed to automatize the articulatory behavior required for correct production of the sound. So it means that thus the child who delayed word final obstruents would be taught by use of multiple but not exhaustive example of syllable closing consonants, the concept of closed syllables. Next, consistency and modifiability of errors. Does the theoretical viewpoint matter? Recent work on treatment outcomes based on approaches developed with psycholinguistic theory in mind suggests that it does matter. As pointed out by Giorod 1998, the treatment plan for a given child is very much dependent on the diagnostic procedures used to identify the details of a child's speech delay. The diagnostic procedures used will depend on the examiner's theoretical orientation. The primary issue in matching a treatment plan to a diagnostic profile is that of generalizations. So, when speech language pathologists use this term, they may mean several things, but the most basic is the spread of treatment effects from a treated sound to other untreated sounds.